Tracy Gilbert.
Thank you, Mr Chair. It's a pleasure to serve under your chairship. In 2016, the Scottish Government announced its intention to reform the Gender Recognition Act in Scotland and introduce self-ID. Years followed and the bill was introduced to the Scottish Parliament in 2022. Since then, according to statistics that started to be published in 2023, waiting times for gender identity clinic appointments are increasing. In June that year, 5,273 people were waiting for an appointment, with 45 people waiting longer than 5 years. At the 31st of March 2024, this had increased to 5,640, with 184 people waiting longer than 5 years. Transgender identity aggravated crime charges have doubled from approximately 40 in 2016-17 to over 18 in most years since 2021, which is unacceptable and must be acted upon and improved. This bill is not improving lives of transgender people. Mr Chair, many people have faced abuse, intimidation and threats for expressing any concerns or opposition to self-identification. I know people whose careers have suffered, been cancelled or dismissed, and respected academics targeted. I've witnessed placards inciting violence and sexually aggressive language towards women, and currently we have the terrible situation of nurses being taken to employment tribunal for standing up for their rights provided in the Equality Act 2010. Mr Chair, these threats and intimidation are almost always targeted at women. During the passage of the Gender Recognition Act, Scottish ministers repeatedly said that it was the most consulted on bill in the history of devolution. However, consultation is only meaningful if you listen to the feedback. One of the areas was ignored by the Scottish ministers was on prison placements. Self-ID was already being implemented in the prison estate across the UK. The issue was raised in the House in February 2019 after a woman was sexually assaulted in HMP Newhall. The then UK Government ordered a policy to review. The Scottish Government did nothing. This is just one example where the Scottish Government ignored warnings, leaving them to defend the indefensible. In the Supreme Court judgment on the case brought by For Women Scotland, Scottish ministers argued that for the purpose of sex under the Equality Act, a woman would be a biological woman, a person who had a gender recognition certificate identifying as a woman, or a person who self-identified as a woman. Had the Scottish ministers won, it would have meant that the rights of one protected characteristic would prevail over the rights of another. Again, a concern raised during the consultation that was not listened to and has been borne out in practice. One example being in March this year, some councillors who strongly support self-ID attempted to defund Edinburgh Women's Aid. The reason for doing so is that Edinburgh Women's Aid provided some services that did not include trans people. A women's project providing single-sex services, refuge and support for women, a lawful exemption provided for in the Equalities Act. Mr Chair, happy to give away.
Thank you, Chair. Does she agree with me that threat to funding Edinburgh Women's Aid was an absolute disgrace, and we should be ashamed that that was even discussed in Edinburgh?
Absolutely. Thank you, Nat. I thank you for your intervention, and it brings me on to say that were those councillors really saying that trans people wanted to see vital supports withdrawn for women fleeing violence and abuse? These politicians do not represent the views of any trans person that I have met. Mr Chair, self-identification has an impact on a number of protected characteristics across the Equality Act. Of course, we must do more to help and support trans people live healthy, happy and fulfilling lives, and we must bring respect and dignity to all. Trans men and women remain protected by the Equality Act that was proudly introduced by the last Labour government. Trans people must have appropriate services and protections from discrimination in the workplace, but this should never be at the expense of other protected groups. We all know that from the Sullivan Review that data is not being collected accurately and institutions continue to blur the lines between sex and gender. This is leading to gaps in provision for all people across communities. Replacing sex with gender identity erases biological difference, which is critically important for medical and health issues, criminal justice, education, sports and the rights of lesbian and gay men, to name but a few. Mr Chair, in conclusion, it is vital that we have an open communication with trans people to move this conversation forward. We all have a responsibility to remove the toxicity from this debate. This is not about winning or losing. It's about how we provide trans people with services, help them to live dignified lives, but with the understanding that sex is not an identity and gender and sex are not the same thing.